I'm Shannon Altum, and this is my interview presentation, Conducting the Clinical Interview in Mental Health Counseling for Psych 421 Psychological Measurement at Liberty University. The clinical interview is a foundational tool in psychological assessment and diagnosis. It allows mental health professionals to gather essential information about a client's background, symptoms, and overall functioning. It differs from general interviews by adhering to ethical guidelines and psychological principles. This presentation will explore how to effectively conduct a clinical psychological interview, including the key components, techniques, and considerations that ensure accurate and respectful assessments. There are 3 types of interviews. Clinical interviews can vary in structure: structured, semi-structured, and unstructured. Structured interviews use specific questions and are common in research or diagnostic settings. Semi-structured interviews combine structure with flexibility, making them ideal for therapy and assessment. Unstructured interviews allow free flow and are useful in building rapport. Each format can incorporate client history, behavioral observation, and the mental status exam as needed. The professionalism and appearance of the interview is also important. A clinician's appearance and professionalism fosters trust and sets the tone. Dressing appropriately and showing calm, empathetic behavior helps create a safe space. Being punctual, prepared, and ethical demonstrates respect for the client. Professionalism supports effective rapport and encourages honest communication. It reflects reliability, which is crucial for establishing clinical credibility. When beginning the interview, start with a warm introduction, explaining the purpose of the session and reviewing confidentiality. Set expectations and allow the client to ask questions. Use open body language and a calm tone to ease anxiety. Begin gathering client history. Cover background, presenting issues, and family context. As BB 2021 emphasizes, this phase is crucial for establishing the interview structure and therapeutic alliance. As a reminder, verbal and nonverbal communication play a critical role in the interview process. The professional should ask open-ended questions, use active listening and summarizing what the client says. They should maintain eye contact and proper posture, that warm, open body language again, and they should match verbal and nonverbal cues. Remember, ask open-ended questions. They need to be culturally sensitive as well and tailored to the client's needs. Avoid leading or double-barreled judgmental questions. Ask with intention, allowing space for reflection and expression. Questioning should also support behavioral observation and insight into cognitive and emotional states. These strategies align with clinical interviewing principles and ethical care. Remember to use follow-up questions. Follow-up questions deepen the understanding and clarify responses. They show active listening and validate the client's experience. Follow-up support exploration of symptoms, relationships, and history. Thoughtful follow-up also enhances the accuracy of the assessment and may uncover important mental status indicators. They reflect the interviewer's skill in guiding a meaningful conversation. Behavioral observation includes noting the client's affect, posture, speech, and eye contact. These observations contribute to understanding mood, anxiety, and thought processes. The Mental Status Exam, or MSE, is a structured tool used to assess cognitive functioning, mood, perception, and judgment. Together, behavioral observation and the MSE provide objective data that support diagnosis and treatment planning. Cultural background can influence expression, making multicultural competence essential, and as stated in Su et al. 2019. Close the interview by summarizing what was shared and checking for understanding. Offer next steps or treatment planning when appropriate. Reassure the client and allow time for final questions or reflections. Behavioral cues during this phase can offer insight into client comfort or resistance. As BB 2021 notes, endings should uphold structure, safety, and client empowerment. Thank you for watching my presentation, and hopefully this helps you do a great clinical interview. Have a great day. Thank you.